My name is Steve Letsike. I work for Access Chapter 2. And I'm also part of South African National AIDS Council and the National Task Team on Hate Crimes. We're dealing a lot with young people. We're dealing with young people between the ages. If I look at across programs, we're talking from age 12, and if you're looking at the oldest that we've ever served would be around 15.
Okay.
So we're dealing with quite vast, but majority of our program is working with youth. And because of our youth program, we've got multiple youth programs or projects that we're implementing. We've got the youth chapter ambassadors, and which is looking at leadership, skills building, and better health seeking behavior. And we're looking at sexual and reproductive health and rights, and looking at also working with youth in the schools, youth in the TVET colleges as well. So first, maybe let's talk about the name Access Chapter 2, because that's why the organization was founded. Organization founded based on the Constitution, Chapter 2, which is the Bill of Rights. So for a very long time, one has been working in the LGBTI or human rights issues, but human rights or Chapter 2, which is the Bill of Rights, is not accessible adequately to everyone. So we needed to make it a realized availability or access. And so our mandate is pretty much clear to ensure that LGBTI persons, women and girls in all their diversity, have adequate access to the Bill of Rights. So we promote, protect and fulfill the rights as enshrined in the Constitution. And through that, we use advocacy, where we can hold government to account, where we work with government and sensitize that government in ensuring that these services are adequate. So it's vast of our programs that we work around. I think, look, health, it's a right. Section 27 of our Constitution, makes that right an obligation for the state to saying every citizen or every person in South Africa has got access to health. And whether or not, and government has tried to implement quite a number of things. You've got interventions that takes place in health, but you also have got principles, whether they are right-based, Batopili principles, to try and ensure that everyone can access the health services. You've got patients' rights, you've got health providers' rights and responsibilities of both across. And it was a question when I remember 2004, there was a study that was done. And this study revealed that LGBTI persons are rejected in health services. And those who are rejected, or those who see others rejected, they delay seeking health services because of fear of stigma and discrimination. So what we found out is that there are lack of services that are competent, that are accessible. So part of it is that we've seen now a rise of LGBT organizations to try to develop specific and competent services. Organizations such as our Triangle in Cape Town, Durban Center in KwaZulu-Natal, and really what we're then seeing is that let's look at specialized, but also let's look at how we can improve of that. But I think fortunately, where we are, we're at a time where through advocacy work and many organizations that have put, was trying to then say, health, can we then try to expand and upscale services where LGBTI persons can access? So what we've seen in the past years is that there's been broad sensitization trainings which is targeting healthcare providers. And part of that broad sensitization is to say, let's improve access into health so that a nurse or a doctor is just not friendly, right? Because we don't want any nurse or doctor saying, hi, how are you? We want competent service where you can look at packaging interventions that are relevant. We want you to be friendly, but you need to be competent. So part of that is that for all these years that are coming up, we're still going to focus to improve a better health access to LGBTI person. And fortunately, South African National AIDS Council have recently launched what we call the LGBTI HIV plan. And health is a custodian of this plan. The Minister of Health, and he also in fact was one of the people who launched this plan. And it's a 5-year plan aligned to the National Strategic Plan 2017-2016 that says we want LGBTI persons to be healthy in this country. So this is a commitment that our government is doing. And this is a commitment as activists, as NGOs, we want to twin and say, we will help you reach LGBTI persons. And that's what we do as organizations. I think first, you need to go out and access, because it's very key. And we can't expect where services are at, because they're in our communities, to always come to you. If you feel that you've got headache or you've got cough or whatsoever, it's very crucial that people must go to check their own health status. So this speaks to our own behavior. This speaks about our own responsibility. This is my body, it's nobody else's body, right? So we seek the responsibility first from self. And we also then say, when you access service, we're hoping you're going to access competent service. And if it's not competent, claim your service to be competent. So this is about voicing, because in each clinic, there's got boxes of suggestion, complaints, whatsoever. Put it out there. You can be your own activist. Don't wait to come report it in your own facility to say, I was not served equally. And I remember, for instance, Access Chapter 2 launched a campaign called I Serve Equally, trying to mobilize health workers to serve population equally. Now, you can claim that I have not been served equally, and this is what needs to change. These are recommendations that facilities always review, and it helps to improve. And if it's happening in a very large scale, it's prevalent. So organize yourself in communities to claim the competent services. So my message to any ordinary citizen, to LGBTI person in particular, is that we've got a constitution first that protects all of us. And it is only if we are out there to ensure that we enjoy the rights as enshrined. So first take responsibility of yourself, your family, your community and society at large. It can only change with all of us being